Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Okay. Now we have safe strategy for trachoma. That is trachoma treatment. So in the trachoma treatment, first we have safe strategy. In safe strategy is actually given by WHO. It is mainly to control the trachoma in community. Okay, this safe stands for S for surgery, A for antibiotics, F for facial cleanliness, E for environment. S for surgery, A for antibiotics, S for surgery, A for antibiotics, F for facial cleanliness, and E for environment. Then, if you see the treatment of choice for the trachoma is azithromycin is given as the treatment of choice for trachoma. Then other drugs like tetracycline, it is actually the drug of choice is erythromycin. Other drugs like tetracycline ointment 1% or topical erythromycin eye ointment or topical sulfonamides eye drops and eye ointment can be used. Topical sulfonamides eye drops and eye ointments can be used for trachoma.
thank you and thank you for watching.